Children's has decided to begin to deliver care via telemedicine for a variety of reasons. One is that very, very few communities in the state of Georgia are large enough to support pediatric subspecialists. In other words, you have to have a certain number of patients for that doctor to see enough patients to basically stay in business. So this way we can see patients from many different sites all in the same day. So we could, in theory, see a patient from Valdosta and then 30 minutes later see a patient from Blue Ridge while we're sitting in a desk here at Children's, and the patients go to a place that's less than 5 to 10 miles from their home. Medicine can benefit the patient and family in a number of different ways. For example, if you're coming from Valdosta to Atlanta, you miss an entire day of school, and this way you might only miss a morning or an afternoon. Other things would be cost. I mean, with the price of gasoline, to drive 200 miles each way is extraordinarily expensive. So, and it'll help our environment as well to be able to give people the information that they need without having them get on the roads and waste resources. Sure. So to perform a telemedicine cardiac consult, the physician or nurse who's presenting the patient would get some demographic information and vital signs from the patient, and then would tell me why the patient is being seen, and then would help with the physical exam. For example, placing his or her hand on the precordium and telling me what they feel, feeling pulses in the legs, feeling for liver enlargement or liver distension, and then they would move the telemedicine stethoscope around the patient's chest and on the back. And what sets this apart from other telemedicine networks is that many of them don't even attempt to do a physical examination. They just do an echocardiogram and transmit the echocardiogram images. Not everyone who comes to see a cardiologist needs an echocardiogram. Echocardiograms are very expensive, so we're trying to judiciously use the expensive technology and to still provide the same level of confidence to the family and the patient that their child either is or is not normal from a cardiac standpoint. I heard an interesting speech one time by a dermatologist in New York City, and he said that they had a difficult time getting their patients to go like 10 blocks in New York City. And we're asking people to drive 180, 250 miles, park, drive through Atlanta traffic. I mean, many families just won't and can't do it. They don't have the resources to do it. So to be able to provide high-quality subspecialty care within a few miles of their home will greatly enhance the ability of our patients with subspecialty needs to see doctors.